In the UK, one young person dies suddenly each week due to undiagnosed myocarditis. In this video, I'll be telling you what exactly myocarditis is, how we diagnose it, and what treatment is currently available. Myocarditis is inflammation of the heart muscle. Typically, it affects young people who are normally fit and well, but it can affect people of all ages. It's usually caused by a viral infection, usually from gastroenteritis or the tummy bug, or from a flu-like illness. Everyone gets a viral infection at some point in their life, and most people will recover with no problems. However, in myocarditis, the immune system goes into an overdrive, where the immune cells attack the heart, and the heart, as a result, becomes weak. The patients then develop symptoms of heart failure, or occasionally, and very tragically, can develop heart rhythm problems caused by the scarring of the heart from the inflammatory process. This can be lethal, and patients can suffer from sudden death, so it's an important condition to be aware of. The symptoms of myocarditis are diverse and can mimic a heart attack, where the patient presents with chest pain. It can also have signs and symptoms of heart failure, with breathlessness and ankle swelling. Diagnosis is therefore challenging, with no specific blood test, and taking a biopsy of the heart is definitive but high risk. In practice, the first test is usually an ECG, and we also can do a blood test with troponin to look for signs of heart injury. We then usually do an echocardiogram, which can tell us about the function of the heart. If there is still diagnostic uncertainty, we can do a cardiac MRI scan, which tells us about what is going on inside the heart muscle. On an MRI, there is typically focal epicardial late gadolinium enhancement and edema on T2 weighted imaging, meaning the heart is scarred and inflamed. We then usually do a follow-up scan in individuals to ensure resolution. Some patients, depending on the presentation, can also have a coronary angiogram. The reason for this is that, as I said before, presentation can mimic a heart attack. The coronary angiogram is usually normal unless there is coexistent disease. In some centers, a heart muscle biopsy may also be performed, but carries additional risk. Most people get better without any specific treatment, apart from rest, anti-inflammatories, and avoidance of exercise whilst the heart recovers. There are currently no specific therapies to tackle the underlying viral infection. In about a third of patients, the heart becomes weaker and enlarges, called dilated cardiomyopathy, and this may require treatment with heart failure therapy. So to summarize, myocarditis is an inflammatory condition of the heart muscle, usually caused by a viral infection. Treatment is supportive, and most patients recover from the condition. Some people get a weak heart that requires heart failure treatment, and unfortunately, in some cases, people can die from it, so it's a condition that must be considered and treated with care. Thank you for watching.